after root. Were you guys able to find the only one I could not find and I have to put in is the Capitan into the computer because it's not popping up.
Did you find the cataphractic?
Yes.
Okay, perfect. Patient's name.
Patient's name. His name is Mr. Andrew Phillips.
Good job. Okay, age 82, gender male. What's the diagnosis for the patient?
His diagnosis, he has congestive heart failure for his history, diabetes mellitus, and hypertension.
Very good. Are there any allergies?
No known allergies.
No known allergies. Okay, can we match the drugs? His old prescription, okay, and new for his diabetes mellitus.
He is using the glucotrol.
Very good. Glucotrol for his diabetes mellitus, for his DM. Okay. Cataphractic TS, is that a brand or a generic?
That is the brand.
Okay. What's a generic?
Clonidine?
Clonidine. Remember in pharmacy, we don't say "ein." The Americans pronounce it as "ein." Diphenhydramine, not mine.
Yes,
Clonidine. Okay, Clonidine.
Clonidine.
What is Clonidine for?
It is used for hypertension, to lower the blood pressure, prevent strokes, heart attacks, and kidney problems.
Okay, what does TTS stand for?
I did not get that information.
You know, okay. What form is this? Is this a tablet, a capsule? What is it?
This one's a patch, ma'am.
Very good. It's a patch. Where do you apply it and how do you apply it?
It would be dermally, ma'am, and it's apply one patch every week.
Okay, one patch every week. So one patch lasts for 7 days, then another patch, 7 days, then another patch, 7 days.
Yes, ma'am.
Okay? I want you to tell me where it's applied. Is it on the arm? Is it on the thighs? Is it on the abdomen? And I want you to tell me what TTS stands for.
Yes, ma'am.
Okay, right now. Get up now. TTS. You don't have to worry about the prescriptions are the same for all of you, because there's so many questions I can ask for each prescription. That doesn't mean that I need to answer these questions, it's the same questions you're going to answer.
So it is applied on clear, dry skin, hairless area of the upper outer arm or upper chest.
Okay, there you go. Upper outer arm, which is here, or upper chest. But you have to clean the area first. Okay. Dispense how many?
Dispense 4.
Dispense 4 patches. So how long will that last if you have to apply one patch 1 week?
So 1 week, one patch would be 1 month.
1 month. If I ask you what's a day's supply, that would
30
be
days.
30 days. Because again, in pharmacy, 1 month is always equivalent to 30 days. Let me see your label. 26 and the big one and the 20.
So for the day supply, quantity per dose, so that
Calculate.
so what would you put for? Because
That's a decimal.
yeah.
Quantity per day. Put a quantity per day. That would be a 7. So
So it'd be 7.
no, it's not 7 per day.
Yeah.
1 7. So one out of 4, that would be 25%. Isn't that right? Let's try if it's calculated that way. Quantity per day would be 0.25.
Yeah.
Quantity per dose would be.
Wait, no.
Try that to 0.25. Just get that one.
Okay.
Refills 3, because it doesn't calculate it. Can you override day supply? Be 30 days. Make it 30. No, you can't override it. The system doesn't override it. Okay, but you know that it's 30 days supply for 4 patches.
Yes,
Okay. Tony, you ready? You ready?
Yes,
Yes,
the
no.
first 2.
Okay, remember, Remember, do not neglect the other prescriptions on the top. Huh? My questions may be based on that one. Okay? My question may be based on that one. Yes. Okay, because we have to match the diagnosis to the prescription, be it past prescription or current prescription, because that history tells you maybe the patient's still on that prescription, okay? Or maybe the patient did respond well on that particular prescription, so the patient was changed, or the prescription was changed to another prescription, and it's being tested right now how the patient is going to respond to this new prescription. Ready? You should be on prescription 3 and 4 because we're on our second hour. Ready? Okay. Said you're ready at the ear? Caught up? Catch up slowly. Ready, Amy? Not yet. I know you'll have a hard time putting in the day supply for the patch because we couldn't override the patch in the day supply. And we couldn't even put fraction or decimal. We tried, Kevin and I tried like 25.25. Robert, you ready? We're going back to the lab. 10:35, 10:37, 10:37 right now. Let's go on a quick 10-minute break at 10:45. Yeah. Nicole, you're doing okay? You ready? Yes? Not yet? You ready at Siri?
I think I did the first two.
Okay.
Do I need to have it right on the computer?
Yes, because I look at the prescription too. Azirius, are you ready?
I think I did the first two.
Okay, let's do this. Hygiene is one of our drug words. So I'm going to ask you about hygiene. Okay? Are there any allergies for this patient?
Allergies to penicillin.
Very good. Penicillin allergy. So hygiene is for what? Match it to your diagnosis.
To the BP, prostate, hyperplasia, and
Okay. It's for BPH or benign prostatic hyperplasia. Okay.
hyperplasia.
Very good. Hygiene, is that a brand or a generic?
That is the brand.
What's a generic?
Zocin.
Zocin. Yeah. Okay. So what's the SIG? Can you translate that SIG, that chicken scratch SIG?
Yeah, so to take one tablet by mouth at a time.
Very good. Okay, so the doctor put for prostate, so you have to put the words for prostate. How long is this prescription going to last?
For 30 days.
30 days. What's the quantity to be dispensed? 30. Okay, and then 1 at bedtime, so it'll last 30 days. Are there any refills?
There is no.
No refills. So no refills would be NR or 0 on your profile. Let me see. Patient is wrong. Oh, this is I'm sorry. Lowercase. What is that lowercase? Which one is for
Did you get to the
gout?
Was it just all that?
Old or new
No,
prescription?
because the ACE inhibitors, I think they're all just. So just all. And then.
I think I need
Is
to
there a
answer
therapeutic
that.
class for it? Because
Right,
that's the
I
only
need-
thing I couldn't find for.
Which one's for gout?
It is.
Colchicine.
The colchicine is the one for gout. Okay? So I want you to realize that those diagnoses don't particularly pertain to the current prescription. Right? There may be prescriptions in the past, okay, that pertain to that. That's why I said, don't just focus on what you received. Look at the patient profile and look at the history, because it will tell you something. Isn't it easier to figure out what the drug is, even if it's in chicken scratch, if you know the diagnosis? Yeah, and then you'll find the first 3 letters, then you have all those options.
That's the
So it's hard to read, yeah? But if you know the diagnosis, it tells you something.
Because
That's how you become strong in your drugs, in your top
So that's why I
200,
watched my
in your pharmacology.
I don't think I have.
We're moving back to the lab.
I'm done.
You done? Good job. Second one,
Pregnancy
second page.
category D.
Digoxin. Okay. Is that a brand or a generic?
I guess it's not therapeutic.
Patient's name is Jim Lewis, age 82. What's the diagnosis for the patient?
Dispense 9.
Congestive heart failure and hypertension. Any allergies? No, okay. What are the previous prescriptions on top of the 2 new ones that you received for this patient? Okay, Lasix and Lanoxin. Which you said is the digoxin. Which one is the brand, which one's generic?
30 days of
Oh, for the deduction?
Yeah, for the digoxin.
The brand is the Lenox.
The brand is the Lanoxin, the generic is the digoxin. What is it for? It's for his CHF. Okay, what's the strength that was prescribed to the patient? 0.125 milligrams. Is it available in other strands? Yes. Okay, how much do you have to dispense to the patient based on the prescription? 100. Can you tell me the same in complete format, in English, in complete sentence?
One tablet by mouth daily. Regular every day.
Yeah, has to be daily. Okay, take 1 tablet by mouth daily. So if the patient's given 100, take 1 tablet by mouth daily. What's the quantity? What's the day supply? 100 days. Are there refills?
No.
And R stands for?
No refill.
No refill. Okay. You have another prescription. What is that drug?
Cinephril.
The Cinephril is a generic, but what's the brand?
This drill.
Okay. That was the brand that was given, but we dispense the generic all the time. Okay, it's not responsible. Why do we do that?
Because what the insurance covers.
Usually what the insurance will pay for, what the insurance covers, and it's usually that's the cheaper one. What's the strength for your Cinephril? What's Pril again? ACE inhibitors. Okay. So it's for hypertension. Good job. That's your second page.
Yeah, sure.
That's your third. Did we do a second one? Not yet.
Not yet for the first page, I didn't do my second one.
Okay, one more.
Oh, no, this was.
That's your second page?
Yeah, this my first, this was my second.
Oh, okay. Third, not yet?
Not yet.
Okay. One more. See, your senior is setting a good example. She's on it. It's just 10:43, and she's already on her 5th and 6th prescription. You guys have to get caught up. Who's ready? 2 minutes. Joey, catch up. Freshman. Cody. What's up? First page. You ready? So we're not printing. That's why I'm going around now. I can't wait for you to be in the pharmacy. Okay. The pharmacy prints, but this lab, computer lab doesn't print a prescription.
The patient's name is Art Harris.
Okay. Are you ready?
Oh, I thought. Oh my, I'll take mine.
Okay. Patient.
I apologize.
Okay.
Even if I get skin colored ones?
Skin color is fine.
Okay.
Just in there. Okay. But I really don't want to.
Okay, I'll
That's
just
a
take mine.
preference. Patient's name, Art Harris, age 66. Tell me the diagnosis of the patient.
The diagnosis is hypertension, EPH, which is benign prostatic hyperplasia.
There's only one person who said this right, Kevin. Benign prostatic hyperplasia.
I
Okay.
just said that. It started a little slower, but I said it.
Okay. And that's how it, yeah? Okay.
Prostatic.
You're like, oh, enlarged prostate. You're trying to avoid to say it.
It's a child, but I said it.
Yeah? Okay, so say it again.
Benign prostatic hyperplasia.
Okay, very good. Okay, DM.
That's diabetes mellitus.
Meticulous
What is it?
is Miss L. Okay.
Mellitus.
Meticulous is me. Okay. So what's DM?
Diabetes.
Mellitus.
Diabetes mellitus.
Mellitus. DM is diabetes
I've been saying it
mellitus.
all day and I read it. I don't know what it's switching in my head.
Mellitus. What's OA? Not overacting. What's
OA is,
OA? I don't know.
Osteoarthritis.
Osteoarthritis. Okay, and then gout.
That's gout.
Okay, let me. Can you match the prescription for? Did you check all the previous prescriptions?
So look.
All of them?
Yeah.
Oh my goodness, no.
Oh.
Oh my goodness.
I'm gonna cuss.
Whatever. I told you, do not just focus on the current prescription. Check the patient's history. Check what other prescriptions the patients have, because this may be given in the past and then it didn't work, so there's an update, okay, on the prescription, or this may be still current prescriptions that go hand in hand with the other prescriptions to help with specific disease. Like hypertension usually has multiple, okay? When a patient is being treated with hypertension, and then combination osteoarthritis, combination gout, combination diabetes, and then benign prostatic hyperplasia, all of these drugs or prescription work hand in hand. Okay? Let me see if you're paying attention. Which amongst this prescription, current or past, is for gout?
Colchicine. That's what
Which
it
is
is.
one of the treatments you're given for in the hospital for COVID, not COVID.
Really?
Okay. Vitamin D3. Cholecalciferol, which is vitamin D3. Ready? Round two? Okay. Round two. Brand name Zestril. What's a generic? Lisinopril, another pill, so that is it's for hypertension, class, basic inhibitor. Very good. What's the strength that we need to give to the patient?
10 milligrams.
How many do we have to dispense?
30.
30. Are there any other strengths
Yes,
available?
there are.
Do you know what they are?
5 milligrams.
Can you tell me this thing based on the prescription?
Take 1 tablet by mouth daily.
Very good. How long will this prescription last?
30 days.
30 days, because you need to give how many?
1 tablet by mouth daily.
Quantity to be dispensed would be 30. Okay, does the patient have allergies?
No, no, no.
No known allergies. Can you tell me which one? The diagnosis of Jim Lewis is hypertension and congestive heart failure. Of these 4 prescriptions, 2 are in the profile and then 2 brand new ones. Which one is for hypertension? This Zestril. What else?
That's it.
That's
They're
it?
both for congestive heart failure.
Okay. What about the Lanoxin, the digoxin?
No, Noxin is for congestive heart failure.
Okay. Actually, all this combination work together for the CHF and for the hypertension. But specifically, the Zestril, you're right, is an ACE inhibitor, so it's for hypertension. Okay? Very good.
Wait, one more.
One more round 3? No, no, no. I'm just choosing one per page. Yeah.
So I can go to the next page.
Half a tablet
or 2?
No way. I'll ask you.
half. Page 3 looks half. See, that's why we don't like those fractions.
Miss, what is this prescription?
That's true.
2 times a day.
Yes, you're
A
right.
whole tablet.
You haven't got
Every
some
day.
in first page.
So they take a whole tablet.
That's true. Hydrate. Ask you about hydrate. That's one of your drugs. Hydrate, how many do you have to dispense? 30. What is it for?
A little hangry.
See? Once somebody starts saying it correct, everybody starts saying it correct. She said it's benign prostatic hyperplasia. Okay. That's correct. I said once somebody starts saying it correct, everybody starts saying it correct. Okay, benign prostatic hyperplasia. Very good. Okay. So, what's the strength that you need to give to the patient? For hydrate. Strength. The dose. The strength of the drug. Hydrate what? Is it 10 milligrams, 100 milligrams? It's very good. Strength. Yeah.
Losing a little bit of
Five
knowledge.
what? 5 horses? 5 milligrams. Are you sure it's milligrams? Not micrograms?
Which one are you on?
I'm gonna make you doubt yourself because I want you to be sure of what you're saying or what you're telling me.
Did you,
I want you to check. Are you ready or not?
oh yeah, I'm on those too. So, did you also, before she comes by, ask, like,
Okay. Ready,
did
Joey?
you look up what these mean and what these are for? Yeah, because those for sure.
Okay, first
So
Terry.
who are you looking
Tell me your
at?
patient's name.
Name is Paris.
Or Paris.
Oh, Paris.
Old diagnosis.
So, go
Okay,
back.
stop.
Go back to
Allergies.
patients.
Allergies.
They're right there.
What's PCS?
Yeah.
Penicillin, correct. Okay. Let's look
So
at
this one's
patient.
the.
What's the strength that you are going to give to the patient?
5 milligrams.
Okay.
5
Go
milligrams. It comes in capsule
search here.
form. Tell me the sig in
Put
complete
art, Paris
sentence
again,
using
Paris.
layman's term based off of the prescription.
So
And then
take one
try to
tablet,
use-
one capsule, sorry, by mouth every night as needed for prostate.
Which one
Okay.
did you choose last time?
QHS is at bedtime.
Choose.
What I told me, at bedtime. Not at night. Okay?
You
I
said
know
this one?
bedtime is night.
Try the other one.
But QHS really
There
means
you
que
go.
horas son mi at
So,
bedtime.
Perazone,
So you
capsule.
have
Just
to
make sure they match
translate
the
that
same.
sig at bedtime. Okay? How many do you have to dispense?
30.
So how long will this prescription last?
30.
31
Days.
days. Are there any refills allowed?
No refills.
Okay. Let me check again. Tylenol number 3. What do you think that Tylenol number 3 is for? There's a Tylenol number 3 prescription. Right? Okay. Remember the T3? Schedule 3 with 30 milligrams of codeine and 300 milligrams of acetaminophen. 330, 300. What do you think? What is painful, you think? That's for pain. Of the diagnosis, what do you think hurts?
Osteoarthritis.
Osteoarthritis hurts. There's another one that's possible. Gout hurts. There's another one.
The benign.
BPH is the last on that hierarchy. There might be pain with that prostate enlargement, but there's always, it doesn't always follow. Okay, BPH doesn't always follow that there's pain. Okay, enlargement of prostate. There may not be any pain. So primarily it's for OA, osteoarthritis, and the gout. Okay, in combination with, of course, the other drugs, colchicine. Okay, so hygiene is for what?
Is BPH.
BPH, benign prostatic hyperplasia. Can you say that?
Benign prostatic hyperplasia.
There you go. See how it's a domino effect?
I was the first one, so that wasn't good.
Nyla was trying to avoid saying it, so she said enlarged prostate. Okay, I don't see a large prostate in there. You better tell me what that BPH is. Yeah? It's like, yeah, it's like trying to tell me that I know what it is, Miss L. However, I could not pronounce. Yeah, no, don't get it away with it.
Next page, Michelle?
You ready? Round two?
I could do the next page?
Yeah.
Okay.
Yeah.
No, I didn't finish.
Okay. Eileen's gonna be on round 3, Leela's gonna be on round 3, right?
Yep.
Kevin, you did 1 round.
I think I'm ready for round.
Round 2? Good job.
I think I'm ready for that. It's
I'm
an
ready
I think
too.
myself.
Robert! Catch up. Okay, where's the second? What does it say? What's the bread?
HCTZ,
Oh my God,
that
you're not
stands
ready!
for-
First question I asked you! Let me check if Miss Jamie came in.
That's true. I got it.
I think we just.
That's the
got it.
hydrochlor
got it?
True, yeah.
Oh my God, sounds like a toothpaste brand.
I used, yeah.
That's true,
It's for
it's
hypertension
generic.
fluid
This is
retention.
a trail ticket.
Like a people are sick during the day.
If it's a krill, what is the class? ACE inhibitor.
Yeah.
Right? What are ACE inhibitors for?
For hypertension.
For hypertension, okay. Allergies.
No allergies.
Fun to learn.
No known allergies. Okay, I want to go back to the classroom. Because we're getting
They
loud.
had a
I
front desk
know,
all
and
day.
this is the office, so he might need us to big, which we all are all the time, so,
we're not helping.
you know,
Pterozoes.
but when we're in our own kingdom, we can just, okay. So, can you match lisinopril
Listen, for the hypertension.
for the hypertension?
Yeah.
Okay, what are the other prescriptions in the patient?
Well, he comes with the same one as this one for the heart failure,
Uh-huh,
which is the digoxin.
uh-huh,
And then he has lastly, which is furosemide, the generic for hypertension as well.
for Lasix,
Lasix.
hypertension.
Yeah.
Did you notice I specifically chose this drugs because it coincides with your drug words, it coincides with the pharmacology that you're gonna be starting on Wednesday,
Yeah.
okay? So, refills for Zestro. 4. What about for Lenoxin?
No refill.
No refill. What's THF? Which one? It's not.
Congestive heart failure. Or chronic. Oh,
Congestive.
congestive, yeah.
I don't know why you're
I
on
don't know
chronic.
why
That's
either.
why. Okay, good. Second round. Kevin, you second
Yes.
for your second round. Let's get out of here and go back to our lesson.
So Nitron is
Oh, so you stapled it differently.
yeah, I stapled
Okay.
it differently. So this is my
Arcara,
second.
same prescription. What's the allergy?
Allergy is for penicillin.
Okay, can you match this drugs to the diagnosis?
So
First one.
the first one, colchicine,
Uh-huh.
is for anti-inflammatory for gout.
Okay, the Tylenol.
The Yep, the Tylenol, it has the codeine, so this is for pain, for the osteoarthritis, the gout, and then the prostatic hyperplasia.
The RNA.
And then RNase is the anti-diabetic, it's to treat the blood sugar level for the patient.
Okay, and then Capitan.
Capitan, that's the same as the first, it's it's for the hypertension.
Okay, and then Hydrate.
Hydrate, this one is used for hypertension as well as a urinary retention.
Okay, so match it here. Which one?
So this is gonna be for the hypertension.
And what have we been talking about Hydrate all along?
Um,
That you guys cannot pronounce.
Yeah.
Oh,
Because it's a nightmare.
yeah, the prostate, the prostatic hyperplasia,
What's BPH again?
the,
You got it first.
the B is benign prostatic hyperplasia.
Very good. Okay, you're done with round 2. Catch up, you guys who haven't done round 1. Robert, round 1, 2, 3.
Okay, I'm ready.
You ready?
Yep.
Why are you not saying anything? Okay, perfect.
So this one was Zestro?
Yeah.
Oh, this is your first page. Gotta press TTS. What does TTS stand for?
It's an ACE inhibitor.
I was ready for this one.
No! If you say you're ready, it can be anything, okay? Because you have to do all of them. You don't choose your prescription. That's why you have to do them. Okay? When I stand next to you and you say you're
The
ready,
only
I
one that they
can
had
hear
before was
one.
the 0.2,
Just tone
so,
down your voice. I
um,
wanna close this. I can't read.
They did.
They have a knot here. How do you see it?
oh yeah,
Lower your voice. I will lower my voice.
go back, it didn't pop up with the patient?
Mellitus.
Oh, you could do 0.1.
See, we just say that.
Yeah, you can do 0.1,
Yeah, right.
0.2, and then 0.3.
It's
where
all
they're
like
at.
that.
The thing is, though, I don't think they would
Ready?
recommend it, like Tony said, the patient's geriatric, and like, it's kind of like,
I know, yeah,
yeah,
it's not
he's
supposed to
not
be.
supposed to be,
I can
yeah.
I was reading that too.
Yeah, I was like,
So let's do paragraph TTS. What does TTS stand for? Kevin, you gotta get back to me on that, but I don't want to ask you until they've found it. Have you found it?
Uh,
The TTS. Kevin said it is going to be applied on the skin. So that's transdermal. You figured it out?
Oh, that would be on med
Catapress TTS is a brand name. What does TTS stand for?
to see how where it would be applied.
Transdermal therapeutic
Either on the
system.
arm, the
Patch.
back,
Okay. Where do you apply that? Were you listening to Kevin?
the arm, the
Upper
back.
arm or the chest, clean area. Okay, so Catapress CPS is for what?
It's for hypertension.
Here,
It's for hypertension. Tell me the SIG.
wash your hands with soap and water before applying,
Use one
on
patch
skin.
every week.
and then
Use
apply
one
to a
patch
black
every week,
canvas
like,
area of the
the
chest,
patient with a
back
chew
side,
patch?
or outer side of the
Apply a
upper arm.
patch
What would that be hairless?
Apply one patch.
That's why you go.
7 days. Apply a new patch
Gotta shave
every
out part.
7 days, okay? But it is better to have it specified to apply it either on the upper chest or on the arm, okay? Because the patient will probably think, where do I apply this, on my abdomen, on my thigh?
Upper chest,
So be
the back,
specific.
the side.
Those are
or
things that we can add. Remember the
outer
root?
side of your upper arm.
Even if the prescriber didn't put that in there, okay?
And then
What is it
remove
for?
any hair from these, clip the hair short, but do not shave it.
It's the same.
Question, so TTS, Robert said TTS stands for, what again, Robert?
Transdermal therapeutic system.
Transdermal therapeutic system. When you hear the word transdermal, right away, the first thing that comes to mind is it's a patch, right? And when it's a patch, it doesn't pass through the liver, right? It gets absorbed right away because it's right there, okay? So it's not like your oral drugs, tablets, capsules, solutions, suspension, that has to pass through the gastrointestinal system or the digestive system, then metabolized by the liver. No first process, right? Transdermal patch.
I can do another one.
The moment you hear the word transdermal, patch.
I got a question.
Similar way as how contraceptives work that are in patch form.
Looking at the last two certifications, I wrote this one.
Apply,
but I'm not sure if you wanna,
just
like,
apply
with that.
one patch every week.
Because you see it looks like one or two.
Oh, okay.
When you're writing half, I prefer that you write the word half, H-A-L-F. Why? 1-2 is when it comes out on the label. So it looks 1-1/2. So it looks like 1 or 2. We don't want that. We want to specify that it's half a tablet that you need to take, okay?
So we need to write that out.
Yeah, H-A-L-F. I would rather that you do that, okay? Because it's more understandable. If you're not in the medical field, you see 1/2, you will think that it might be 1 or 2.
Everybody knows now.
Yeah. We are part of a possible medication error, and we can also be part of preventing medication errors. Okay? And we want you to be part of that. Ready?
Yeah.
Okay. TTS patch. How do you say this thing?
Apply one patch on chest or upper arm every week.
Very good. So can you write the words upper arm or chest on the thing? Yes. Root. You can add the root to be more specific. It's like by mouth. Right? So you don't tell the patient apply one patch. Now the question is where? Right? So the more specific you are, the better compliance for the patient. Apply one patch on the upper arm, on a clean area, on the upper arm or on the chest. Okay? And then how long will this prescription last?
30 days.
How many patches are you going to give? 4. How many refills?
30.
What does, can you match this to the diagnosis?
Hypertension.
Hypertension. Okay, good job. Good job. You want to go back to the classroom so we can start working on IV? Take a break. Yeah, I wanted to take a break at 10:45. It's 11 now.
I think
Who's finishing up something? It's 11:04 on my watch with a few seconds left till 11:05. Let's all go back to the classroom. I'll send you on a 15-minute break. You want to finish one round?
my last page.
Your last page.
Yeah.
Okay, let me just see this label and then we'll do the check off in the classroom. go. Eileen has the key to the classroom.
You know any questions?
Let's go on break. 11:20. Are you gonna go on break straight, or are you gonna go to the lab first? Let's go to the lab first. Let's all go. I didn't see. Hello. Did you get to open it? Thanks, Eileen. Hold it for me. Let's go on break. 15 minutes.
I sure hope so.
It's 11:06. I'll count it as 11:05. Come back at 11:20. Breathe. Move it. Miss Jaylene hasn't come in.
No.
Yeah.
What am I gonna do with my shots? Cause at the base they don't. I don't know.
You talking COVID or your shot for externship?
The externship shot. Remember I told you that they just took blood work instead of giving me the
Or
shot.
tighter?
Yeah.
Okay. When is that gonna come back?
I don't know. It's supposed to be done already. It's been months since I did it, but they never called me back for my results.
You have to follow up because
I
Miss.
have to go again.
Yeah, Miss